Hi, I'm Dr. Brian Kaufman, a retired family doctor, a CLL patient myself, and the co-founder, chief medical officer, and executive vice president of the nonprofit CLL Society here at ASH 2022. Dr. Shah?
I'm Dr. Nirav Shah. I'm an associate professor from the Medical College of Wisconsin, and excited to be here today with you, Dr. Kaufman, to talk about CLL.
Dr. Shah, there's been a lot of buzz about different treatments for CLL here, and a lot of it's been about combinations and about, doublets and triplets. But one of the standalone drugs that's really seemed to make a big splash here is a drug called Pirtobrutinib. And I'm going to read the name of the paper that you're presenting, and that was Safety and Tolerability in Pirtobrutinib in patients with B-cell malignancies, so that would include CLL and other similar lymphomas, who are intolerant of covalently binding BTKs. Results of a phase 1/2 Bruton study, Safety and Tolerability of Pirtobrutinib in B malignancies. So can you break that down in a patient-friendly way so we understand, what you were researching and why you were researching it?
Absolutely, and thank you for that question. BTK inhibitors, I think many people with CLL are familiar, are incredibly active for the management of BTK inhibitors. These drugs have sort of come out in iterations. I think we all know that Brutonib was that first drug that was really a tremendous development for patients with CLL. Unfortunately, one of the downside effects of that drug is that it had a lot of off-target toxicities. It can cause heart problems with high blood pressure, bruising, bleeding, abnormal heart rhythms. And so newer drugs were developed, and the two most commonly used in the United States are drugs called acalabrutinib and zanubrutinib. Now, while those were more precise BTK inhibitors, they were all part of the same class that we call covalent BTK inhibitors. And so despite advances, there's still issues with tolerability with some of these newer BTK inhibitors. Pirtobrutinib is a novel, really new mechanism of action BTK inhibitor. It's called a non-covalent or reversible BTK inhibitor, and it mechanistically just works differently. It additionally is very precise for the BTK, so it doesn't have a lot of off-target effects on different enzymes within our body. And so this Bruton study was a very large study to, number one, identify a safe dose of Pirtobrutinib, and number two, then sort of see its efficacy in different B-cell malignancies, the largest of which was CLL. The specific data that I'm looking at is a subset of data for people who enrolled on the Bruton study, but did so because they were having tolerance issues to the covalent BTK inhibitors. And the majority of that was ibrutinib-treated patients, and they came off of it because they developed an abnormal heart rhythm, or they had severe fatigue or diarrhea, and then went on the Bruton study to see if this would be a more tolerable agent.
And we know from other data that the main reason people stop ibrutinib is not because their disease progresses and the drug fails them, but because they become intolerant of it. That's more than half of the patients in most studies.
And that's an excellent point and a huge problem, right? No matter how effective a drug is, if you can't tolerate it, it's not going to provide the efficacy you need. Or people will do things like skip doses or take lower doses, and then we don't know if the efficacy can be maintained. And so this group of patients all had prior exposure to a covalent BTK inhibitor. The majority was ibrutinib, and they came on the Pirtobrutinib trial to get a BTK inhibitor because of intolerance. And the key finding was that despite having this intolerance issue, the majority of patients were able to stay and maintain on Pirtobrutinib. And those that did come off Pirtobrutinib, which I believe was 5 or 6%, which is tremendously low when you think about the studies you mentioned, Dr. Kaufman, was that those who came off, they did not come off for the same reason they came off of ibrutinib. And this shows you that the toxicity profile is different for drugs like Pirtobrutinib and these non-covalent inhibitors compared to the prior generation of covalent inhibitors.
So let me ask you about the safety issues first. Were there any safety signals? And you mentioned they came off for different adverse events. Can you share what some of those were?
Yeah.
And then we'll talk a little bit about the
Yeah,
efficacy.
I mean, some of them were things that just happened. So some people came off because of COVID-19 infection, an ongoing problem. Neutropenia is probably...
Remind us what neutropenia is.
Thank you. It's when you have a low neutrophil count, which is a subset of your white blood cells. And so that's probably the most common thing that we see. Now, how much of that is a drug, or how much of that is that many of these patients had seen many prior treatments, it's difficult to discern. But a lot of it was probably infectious complications.
And we all know that all the BTK inhibitors, at least early in their course, seem to increase infection risk. There is some encouraging signal with Bruton that after a year or two, the infection rates actually go down. It's a little early to know that with Pirto at this point. How well did it work? Did people's disease stay under control?
Yeah, so we don't have the picture here, but if you looked at the sort of the curves, or what we call our waterfall plots, which tell you how many patients and how deep they responded, basically across the two most common malignancies that we use this class of drugs in, being CLL and mantle cell, nearly every patient responded.
Wonderful. And it's too early to have durability data.
Absolutely.
Any final thoughts or conclusions or messages you'd want to give to patients about this study and Pirtobrutinib?
Yeah, so I think that, Pirtobrutinib, this trial treated almost 800 patients, and it treated them after they had failed basically everything. And despite that, it showed an incredibly favorable efficacy, and really, in my opinion, and I've used this drug as part of a clinical trial, some of the best safety that I've seen. And so I'm excited by the planned further development of this, because, tolerance is a major issue. If you can stay on the medication without it affecting your day-to-day life, you're more likely to take it, and it's more likely to provide you the benefit. And so I think time will tell where this drug will fit into place, but I do think that, it might become a front-line or second-line option in the future.
Well, I'm excited, and the buzz is that we should have it as an option outside of clinical trials very soon.
Yeah, I really hope so. Nothing breaks my heart, because the Bruton trial is no longer enrolling CLL and mantle cell, and those patients, would come to my center for this drug, and now we're waiting, to have access, and I have people that could use it right now. So I really, really hope that this will become available, because, once you've treated 700 patients, you have a pretty good understanding of the safety and efficacy of a drug.
Dr. Shah, I'm so grateful for what you're doing, and I look forward to learning more about your research in Pirtobrutinib. Thank you.
Thank you.